Hey Super Mamas, it's Dr. Joy here and you're watching Super Mama Sunday, and today I'm going to be talking to you about something you definitely want the details on, and that's immediate postpartum birth control. We're going to talk about some methods that are available immediately after delivery so that you can be in the know. Make sure you keep watching. All right, Super Mamas. So we're going to talk about a topic today that is near and dear to my heart. Do you know that 40% of women do not make it back to their postpartum checkup after they have their baby? Yeah, I mean, that's a lot, right? It's like close to half. So what I see a lot of where I practice is that we have women who are having babies very close together. And we know that birth spacing, which is a term that has been coined over the last few years, is very important. We should be waiting at least 12 to 18 months in between pregnancies to give our bodies time to get back up to speed, to heal, to restore our blood count, our calcium levels, our other vitamin stores. And so it's really important that we have a plan for how we're going to manage our birth control after delivery. One thing that has come about over the last, say, 5 to 7 years or so is immediate postpartum contraception. So this is something that you need to ask your OB care provider about and start making plans before you even go into deliver. So in my office, we're talking about this as soon as you get to the 3rd trimester, because for one thing, some women may want permanent birth control. So like they may want their tubes tied. And then other women may want longer acting reversible contraception or LARCs. And LARCs have been shown to be safe and effective if they're put in immediately after a mom births her baby. So the Intra-Uterine Device, or the IUD, is a small flexible device that goes inside the uterus. Once the placenta has been delivered and we have massaged the uterus to go ahead and get it to start cramping back down to its normal size, an IUD can be inserted right away. The IUD works by keeping the inside lining of the uterus nice and thin so that a pregnancy cannot implant, and it also makes the inside of the uterus a hostile territory to sperm. And so the IUD, I think, has gotten a bad rap over the years, but it's actually a wonderful form of birth control. It's what I have. I've had IUDs for the past 15 years. They're a wonderful birth control if they are properly inserted and properly maintained. And so insertion, I think, is the biggest deal with IUDs. They need to be inserted by a gynecologist. I know I'm gonna draw some smoke from some people, but I do think that any sort of uterine procedure really needs to be done by a gynecologist, because if there is a complication or if something happens, the gynecologist has to manage it. So anytime I've seen or heard about horror stories with IUDs, it usually has to do with how they're inserted. I think that they are a great form of birth control and they work just as well as having your tubes tied. So that means if I put 100 IUDs in, 1 out of 100 IUDs would malfunction. And that is exactly the same for if I tied 100 women's tubes, one of those tubules may misfunction and that woman might get pregnant again. So it's really a great form of birth control that you can have in place is before you leave the hospital if you know you might not make it back to that appointment. Several IUDs that are out on the market. We have IUDs that are good for 3 years, 5 years, and even 10 years. There are hormonal IUDs and there is also a non-hormonal IUD. The hormonal IUDs have an added benefit in that they can make your periods a lot less heavy. And so for my moms who had heavy periods prior to becoming pregnant, I certainly recommend a hormonal IUD. Copper IUDs, or the non-hormonal IUDs, are certainly a great birth control if you're not able to use any hormones, if you have a medical condition that might keep you from using hormonal birth control. However, I will say that in the patients that I serve, I've had a lot of problems with those, mainly heavier periods and more cramping. So I don't tend to use a lot of copper IUDs unless I have a patient who has a medical problem and is not able to have any sort of hormonal birth control. Another long-acting reversible form of contraception that's available immediately after delivery is what's called the Nexplanon. The Nexplanon is an implant that goes in your arm, usually about midway between your elbow and your armpit, and we numb up the area where we're going to place it, and then we place it. It has an insertion device, and we just pop it right into the arm, put a Band-Aid on it, a couple of days it's healed, and that is good for 3 years. The Nexplanon actually works better than having your tubes tied. And so if I put 100 Nexplanons in 100 women, 1/2 of one of those women would actually get pregnant based on studies that we've done for this method. So it is a really good form of birth control. And remember, we said that if I tied 100 women's tubes, one of those women would actually get pregnant. So the Nexplanon offers even a little bit more protection, but it is reversible. And to take it out, you numb up the arm and make a small incision right where you put it in, and then just push it back out. So it is definitely easy to take out and easy to put in, but it offers you the same level of birth control that tying your tubes would offer. The Depo-Provera injection can also be given immediately postpartum. So if you're at the hospital, before you go home, if you'd like to have a Depo-Provera injection, then you can certainly have that done prior to leaving the hospital. Depo-Provera needs to be given every 3 months though. So that still makes it imperative that you make it back to your doctor's office or to the health department or at Planned Parenthood to have that Depo done in 3 months. Otherwise, you'll only be covered for the first 3 months after delivery. So let's talk a little bit about the pros and cons of each of these methods that I've discussed. So the IUD certainly is a great method that offers really good coverage in terms of birth control, but if it is not inserted properly, you may see women having more cramping, more spotting, more bleeding. In addition, in the first 3 to 6 months after IUD placement, you may see some irregular bleeding, and that's quite normal. But after that 6-month mark, most people are going to have either very light periods or no periods at all. The same is true for the Nexplanon implant. Irregular bleeding is the #1 side effect. So sometimes bleeding and spotting in between periods can certainly occur. And there are some tricks that we have to use with both the IUD and the Nexplanon, such as using ibuprofen, using 800 milligrams 3 times a day to help dry up some of that spotting or irregular bleeding, or even giving a pack of hormonal birth control pills for a month or 2 to help you re-regulate your cycles, so to speak. With Depo-Provera, how did you guess? #1 problem with Depo-Provera is irregular bleeding. But Depo-Provera has also been shown to cause weight gain, usually an average of about 15 pounds over the first year of use. So if gaining weight is something that you are very concerned about, Depo-Provera may not be the choice for you. There's one additional option that I offer women who are not necessarily feeling the IUD or the implant in their arm or an injection every 3 months, and that is the mini pill. The mini pill can be given immediately after delivery. However, this is probably the least effective birth control that we have that's available immediately postpartum. It has to be taken around the same time every day, and about 40% of women with the mini pill are still going to ovulate and could potentially become pregnant. So it is certainly an option, but it ain't the best option. These are all birth controls that contain no estrogen. We don't like to give estrogen containing birth controls right after you have your baby, because it is already a time when you are at higher risk for developing what's called a deep vein thrombosis, or DVT. DVT is where you have a deep vein clot that can sometimes travel to the lungs. Non-estrogen containing birth controls that we talked about, the IUDs, the Nexplanon implant, Depo-Provera shot, and the mini pills, are safe to use immediately postpartum. However, you would want to avoid an estrogen containing birth control just for at least 6 weeks until that high risk period for developing blood clots in your legs or your lungs has passed. So what about the mom who wants to have a permanent sterilization? She wants those tubes tied, clipped, burnt, removed, whatever. I highly recommend that you have this discussion sooner rather than later with your OB provider. I usually like to have it at around 28 weeks because there may be consent forms that are required by your state that you sign well in advance of having your tubes tied. We hope that every mama has a normal vaginal birth where she feels respected and cared for and safe, but we know that that's not the reality. Sometimes cesarean deliveries are necessary, and if you want to have your tubes tied, it's important that whoever performs the cesarean knows this so that your tubes can be tied right there on the spot. You also want to talk to your OB care provider about how they do their tubal ligations. And so there are several methods of tubal ligation. The recommendation now is for actual removal of the tubes because we know that 80% of ovarian cancers actually start in the fallopian tubes, not on the ovaries. And so if a mom has reached the end of her reproductive life plan, like if you think you're done having babies and you want to have your tubes tied, tubal removal is really the way to go because it can help prevent ovarian cancer, and it can also help prevent future tubal pregnancies, because sometimes when women have their tubes tied, they still somehow manage to get pregnant, but oftentimes that pregnancy gets stuck in the tube, and that of course can be life-threatening if that tube were to rupture and the mom is bleeding internally. So talk with your OB care provider about the method that they use. You can request a method too, although I will say that in some surgeons' hands, they may be better at one method versus another. With tubal ligation, be aware that there is the potential for what's called pelvic congestion syndrome. This is where women start having heavier periods. When they have their periods, they may also have an increase in pelvic pain, and they may see a difference in how long their periods are lasting. So pelvic congestion syndrome does certainly happen. You may have friends or aunties or cousins that say, hey, you know, when I got my tubes tied, my periods just got ridiculous. And so that certainly is a potential side effect of having your tubes tied. Also, very important, if you are not absolutely sure that you are done having babies, don't get your tubes tied. Don't get your tubes tied, because you can use one of the forms of contraception that we spoke about earlier, the long-acting reversible contraceptions like the IUD or the Nexplanon implant. And you can get the same results. You can be well protected from becoming pregnant, but you have the option to remove those and then get pregnant again. The most heartbreaking discussion that I have with women is when they have had their tubes tied or even had their tubes removed, and then they get married to the man, the love of their life or whatever, and he doesn't have any kids and he wants a kid, you know, or they find the love of their life and they decide that they want to expand their family, but they have made a permanent decision. There are doctors out there who can reattach your tubes, but this does not necessarily mean that you're going to get pregnant. And so the more you operate on the tube, the more scarring the tube can have, and the more it can make it more difficult for you to actually become pregnant naturally. Not to mention the fact that you got to have that coin to go get these tubes reversed. It costs money. So that is not something that is generally covered by insurances. If you have had a tubal ligation and you sincerely desire to expand your family, I personally recommend in vitro fertilization. Because yes, you will spend money, but you would have to spend money to get your tubes reconnected anyway. And B, your success rate with IVF is going to be higher. So if you're going to spend the money, you should go with where you're probably going to get the most bang for your buck. In vitro fertilization with a special OBGYN that's called a reproductive endocrinologist and infertility specialist. So that's how I would recommend doing that. Make sure you start talking often and early with your OB care provider about what you want to do for contraception. Make a reproductive life plan. And we've talked about this before if you follow this channel. And that is deciding how many babies do I want to have? How far apart do I want my babies to be? What kind of partner do I want to have these babies with? You know, because that's also a very important thing. And do I have any chronic health conditions that I need to have under control before I think about having another baby, like diabetes or high blood pressure or thyroid disease, or maybe you have obesity where your body mass index is greater than 30. These are all things you want to consider, because having a baby is such a blessing. Having a baby that you have prepared well for and that you know that you are capable of taking care of is even better. So I encourage you guys to talk with your OB care provider about your contraception options and about the plan that you have for your family so that you can make sure that you're well supported. Ask if your hospital offers immediate postpartum birth control. Many hospitals are starting to do this now, and I think it is a wonderful service for women, especially if you know for sure that you may not make it back to your 4 or 6 week appointment. So I hope this video has been helpful. If it's been helpful for you, give your girl a thumbs up. Make sure that you subscribe so that you don't miss a single Super Mama Sunday. And I'm gonna catch y'all next Sunday. Peace.